She's sometimes sad, she's sometimes happy. She's doing things to make her life less crappy. Trying a treatment that's new on the scene. Let's sit back and talk about ketamine.
Hi, everybody. Welcome to the very first episode of Ketamine Insights, a podcast about ketamine for depression by and for patients and the people who love us. I'm Molly, a writer from Chicago.
And I'm Lynn.
And this is Lynn.
Hi, I'm Lynn, our resident genius empath.
And we met, I think, was it 2011?
I think so. Yeah.
And we've stayed friends despite never having lived in the same city. And I think almost never even being on the same continent.
That's right.
So I'm going to tell you a little bit about myself. I have treatment-resistant depression as well as anxiety and a couple other chronic illnesses. This podcast is about ketamine, so I'll tell you a little bit about my experience with ketamine. I've been a ketamine infusion patient for 3 years, and I've had I'd say about 45 infusions over that time. I also regularly take ketamine lozenges at home. And this entire time, I've been lucky to work with a therapist who's trained in psychedelic-assisted psychotherapy and has guided my journey with ketamine. So I've been lucky to do that, and I'll hand it over to Lynn.
All right. So I am a friend of Molly's, as she said, and I am not a patient myself, but am someone who is a friend of people who suffer from depression, Molly, as well as other loved ones in my life, and have followed this journey closely, and am very sympathetic to this what is happening, and very interested in this journey of psychedelics, even though I'm not a patient myself, and am interested and excited to explore this with Molly on this podcast and with all of you, and looking forward to this journey.
Okay, so this podcast, Ketamine Insights, is by and for patients. So it's a space to explore and develop our expertise and our lived experiences, as well as that of our allies, with ketamine for depression. So it's not really a place for therapists themselves and other experts. There are a couple of podcasts already out there that do that. It's also not a place to compare doses or shop for doctors, that kind of thing. I'm going to tell you, just to get my kind of cards out on the table, I really come from the background that ketamine is most helpful when combined with therapy and journaling and all sorts of wraparound work like intention setting, integration. And we'll talk about each of those things in future episodes. We also have an email address if you'd like to reach us. We're at ketamineinsights@gmail.com, and a website, ketamineinsights.com. It's very fancy at the moment. And I think that's it for introductions and a little bit about the podcast. Now, for our first topic, we're going to talk about the different types of ways that you can take ketamine for depression. Lynn, do you know these already, or do you know how many even there are?
I've heard a little bit about it from you, but don't know much. So I'm curious to know the different ways.
Okay, so I think there are roughly 5, depending on how you count. We'll start with the one that is the only one that's approved by the FDA and sometimes covered by insurance, depending on what insurance you have. It also happens to be the worst, if you ask me. And I think not just me, but if you ask a lot of people, it's called Spravato. It's a nasal spray. So you literally just spray it up your nose like an allergy medication. And the reason people don't like it is that it varies. It's the most variable with respect to absorption rates. So different people will absorb it at different rates, making the dosing difficult for different patients.
That's odd.
And even the same patient across time.
Have you tried that one yourself?
I've never tried it. I got approved by my insurance to try it. And then as I learned more about ketamine, I thought, oh, like if you have a cold, for example, it doesn't work as well. You don't absorb as much. So
you can't really control it very much. That sounds kind of strange.
Right. And the other thing about it is that you can only do it in a doctor's office, I believe.
Huh.
And it is it's supposed to be a high enough dose where it creates disassociation, which is like you trip basically. Mm-hmm. It's like a higher level of tripping where you're not really in your body anymore. Mm-hmm. You don't feel in your body. And the difficult thing about the nasal spray and a couple other methods is that you can't stop it once you've started it. So
some methods you can stop, but this you can't.
Yeah, okay. So I'll let you know about the next one, I guess, is the infusion, which is similar to Spravato in that it's supposed to be a high enough dose where you get that disassociation effect. Okay. But
wait, Spravato as in like spray, it's like SPR.
I guess.
That's funny. Yeah. Clever.
I know, they all... There's another like depression / I think mood stabilizer medication called Abilify, which is my favorite name for a drug. Abilify. It's like, well, now that I have Abilify,
all my abilities. Spravato gives me all my bravado. Spray it in.
You spray it in, and you're right. You got all of a sudden my bravado.
Yeah, while I'm in the doctor's office, if I don't have a cold.
Mm-hmm. Right. As long as I don't have allergies today, I'm good. So infusions are similar to Spravato, but they're not usually covered. In fact, I don't think they're, well, at least in Illinois, they're never covered by insurance.
And all of this differs state by state, right? So FDA approved is the spray, Spravato, and then other things differ state by state?
I think so, yeah. So federally, Spravato is the only one that is, federally, Spravato is the only one that's approved. So in every state, that's the case. Okay. It's also the case, I think, that my sense is right now in 2022, there's no insurance that'll cover any of the other forms that I know of. Yeah. So infusions are usually between $300 and $450 a session. And they're about an hour long, and it's a needle in your arm. So that can be unpleasant for some people, but you stop feeling it once it's inserted, is my
it's like just like getting an IV if you've ever had one at the hospital or something.
Exactly. Yep. And they leave it in for the whole hour, and it's really actually about 45 minutes of the actual drug entering your body, and then if your blood pressure spikes or something like that, they can stop it. Okay. So,
but does it stop the sensation, the dissociation, all of that? Once they stop it?
Yeah. So in some cases, if you're having a bad trip, even they can stop it. I've had bad trips and they never stopped it for me. Oh. But I think we could talk about that more. There's also a whole idea that there's no such thing as a bad trip. That your body is doing what it needs to do, and your mind, and you're processing things, and when you feel like it's an unpleasant experience, that's usually stuff that you do need to process. And that
this could be a whole nother episode, like what is a trip, what does it mean to trip, and what is a bad trip? Is there a bad trip?
Totally. This
might be a little scary to some people.
Conversation. It's in my experience, like ketamine, that's why at this point it's done in offices, these infusions and stuff. It's like ideally you'll have a therapist with you in the room.
It's medical. It's a medical kind of setting, right?
Exactly. Yeah. So that's the two. So those are the first two: the Spravato nasal spray and infusions. The third one, intramuscular injection, is also known as IM. And that's actually usually a pretty high dose method as well. It's one shot, boom, into your thigh. and all the drug comes at once, so it's a more intense experience.
It's like taking an EpiPen and just boom, jamming it in.
Totally.
That's kind of crazy.
I've never done IM myself, but it's very similar to an infusion because most places that offer infusions will also offer intramuscular injections.
And a therapist or someone does it for you, or you do it yourself?
Yeah, the physician or the nurse's assistant, or not a nurse's assistant, but a nurse or a physician will do the actual injection. Okay. Yeah.
And then you have your therapist there with you.
Hopefully. Ideally, yeah. Okay. A lot of psychedelic assisted psychotherapists, or a lot of therapists who are trained in psychedelic assisted therapy will sit with you during the infusion itself or during the experience itself and then talk to you for an hour afterward.
Okay, cool.
So you kind of have therapy immediately following the trip.
So with this one, the shot goes into the muscle and it's like there's no going back. Obviously, it's in, it's in.
Yeah.
Okay. Yeah. Kind of like the spray. Once it's in, it's in.
Yeah, exactly. Okay. Yeah, you can't stop it. Yeah. And it is sometimes considered to be a little more effective, I think, because you get more of a dose quicker. But all of that is kind of up for debate still, is my understanding of the current science. Yeah. And so there's just two other ways. An oral lozenge, which is often called a troche.
Troche.
Troche. Yeah, I'd never heard that word before. Huh. And still today, I've been doing lozenges for over a year, and I don't know the difference between a lozenge and a troche. My understanding is like one's waxier or something like that, but they're basically the same. You get prescribed them by a physician, and you take them at home.
Okay, you take them at home. Interesting.
They're made in a compounding pharmacy. Oh. Yeah, so it's a much lower dose.
So made in a compounding pharmacy in the U.S.? That's super interesting. Huh. Are they made in Illinois?
So it's legal.
Do you know?
They're made all over.
They're made all over. That's super interesting.
Mm-hmm.
Okay.
And they, and you generally put them under your tongue and absorb them through the skin in your mouth is the idea.
Oh. How long does it take?
Some people do prefer to swallow it. Oh. It takes about half an hour to dissolve, depending the different consistencies, sometimes a little bit less, a little bit more. And it's most efficient. You get more of the drug if you're letting it absorb through the skin on your mouth, in your mouth. I guess if you swallow it, it goes through your stomach and you absorb less of it. And it also takes longer.
Okay. How does it taste?
Awful.
Oh, so that's rough.
All of
so
them
half
taste
an
awful.
hour and it tastes awful. You think they could make them taste better?
I know. Rough. Like some of them, the first ones I ever tried were like, they tasted like tangerine rind plus vodka.
Oh, that's horrible. For half an hour. Come on.
It's supposed to be like, this one's orange flavored, but it's like, no, it's really not. Like, you clearly tried, but
that's so bad. Oh my god.
You really do have to get used to it. Yeah, I heard that like some people will put chocolate in their mouth at the same time. I've never tried that. I'm not a fan of chocolate with orange, but like, why not? It's worth a shot, I guess. Because it is really bad tasting.
That's gross. And
okay.
So for half an hour under your tongue with this gross tasting thing, I guess it's like medicine, but usually medicine you don't have to sit with for a half an hour.
Yeah, that's the thing about ketamine in general. I feel like it takes time, whether it's an infusion or a lozenge. Like these treatments, it's not the same as an SSRI, where you take it first thing in the morning and go about your day. Like, it's a habit, kind of.
And it's a shame that there isn't something you just swallow, like a pill you just swallow. I wonder why there isn't. I mean, I don't know. I don't know much about ketamine yet. I'm on this journey with you. I'll be learning more, but it's interesting to learn there isn't just a pill you just can swallow. I guess the
lozenges are part of the reason that all of these take time, theoretically, is the experience of the infusion. Similar, the experience of the lozenge, like the tripping or the new insights that you get are a big part of the benefit.
Yeah.
Arguably.
Yeah.
Some physicians will say it's the medicine that does the work.
Yeah.
And that's another topic we'll definitely talk about. But the time, I mean, ideally you could take a pill and still sit there for half an hour and have the experience and not have to have the terrible taste in your mouth. But So to answer your question, it takes about half an hour to dissolve, and then the experience lasts about an hour.
Okay. And does the experience
Usually?
start after it's dissolved, or does it kind of start when it's dissolving?
During, I'd say.
Okay.
Like, for me personally, I don't know for other people. I think it's about the same, where like, yeah, it hits you maybe 15 minutes into dissolving and stays for about 45 minutes total. So the whole thing takes about an hour up to an hour and a half. And the different dosages, like I've seen lozenges as low as 50 and as high as 400, which is a whole nother.
Yeah.
The 400 level is more like an infusion.
Wow.
But yeah, like, and some people experience something on the lozenges, and some people don't really experience much they don't have like an altered state during that time.
But you do.
I do usually. Yeah. And it's very different from an infusion where you're disassociating. It's more like, I never noticed that pattern in the way I, treat women or something like that. Like, it's like you have insights into the thing that you're kind of wondering about, and sometimes random insights that don't have to do with what you're wondering about. But that's, I found really, really useful, is the lozenges, like, taking your time with it and thinking and having new kind of thoughts about stuff you already knew. Yeah. Right? Like, you're not learning new things, but you're thinking like, it never occurred to me to ask so-and-so about this, instead of, I could take a class in it, but I also have a friend who knows all about it. Maybe I'll just call her. Like, sometimes they're more, huge things about, like, your dead dad, and sometimes they're much more mundane things. Okay.
So what exactly does it mean to dissociate? What exactly does that mean? If you could just like define that briefly.
I have struggled with this for a long time, but the kind of textbook definition is that you no longer feel like you're in your body. So when you're doing when you're doing an infusion, there have been times when I felt like I was in a cave, pulling the roof of the cave over me like a blanket, with a real like presence of a dead relative, like telling me that I'm doing good in life, like that kind of thing. Wow. And you're not really if you wanted to move your hand, you might be able to, but you
like the hand of your actual physical body.
Exactly. Yeah. And then at the end of an infusion, like I have an idea that we might do a whole episode on like how to come back to reality, because there are like kind of sadder ways and happier ways to do it, I think. But yeah, like there are times like there have been times when I'm coming out of an infusion where I think to myself, like, what is real? Am I as big as a mountain? Yeah. Am I as small as an atom? What's the right, where, there's a moment there where you're really trying to figure out what reality is. So that's, to me, disassociation. Awesome. Is like when you're really not in the room. Yeah. Okay. And so with the lower dose lozenges, you definitely don't get that feeling, but you still do feel different than you're not completely sober, if that makes sense. Okay. Yeah. Yeah. And then I think like just the final type of way you can do way you can do a ketamine treatment for depression is a rectal suppository, which is kind of similar to a lozenge. You can get it from a compounding pharmacy. You absorb it more efficiently through the skin inside your butt. Okay. So, yep. Okay. I don't know. Like, I've been told you just kind of insert it and then lay down.
Try not to go to the bathroom. Just hang out.
Yeah, don't get up. And then it doesn't taste as bad, right? Or you're not tasting it, but it's probably not comfortable either. I'm not sure.
Yeah, they're pretty small though.
I'm sure. Lozenge. Yeah, I would hope.
They're the same. It's the same as the... Oh, this is something different. Okay.
It's, you get it from a compounding pharmacy similar to a lozenge.
Okay, so they make it specially for the butt. Yes.
Yeah.
Okay.
Yeah.
Okay.
So it's not... The lozenges are often like square, rectangular. Okay. So I think hopefully the rectal suppository doesn't have hard edges or corners. Yeah. I would...
Yes.
Depending on the mercy of the compounding pharmacy. And And I think the rectal suppositories are really meant like similar to a lozenge. You're not supposed to like necessarily disassociate.
Okay.
It's considered like a maintenance regimen. So you'll do
okay.
with lozenges and the rectal suppositories, you'll do those like 3 times a week.
Oh, wow.
Whereas the infusions, after the initial regimen of infusions, where you usually will do 6 infusions over 2 weeks.
That's a lot.
After that, you might do 1 infusion every 6 weeks.
Okay.
So
I see.
You're taking more intense doses more rarely.
Because you don't need them as much. The idea is that you've done these intense doses, you've gotten some insights. It's like some that have helped you. And then you do these milder doses at home that are kind of just helping with maintenance.
Exactly.
Okay.
Yep.
And that's been your experience?
Yep. Yeah, I guess the idea with the initial regimen of 6 infusions is that you use it to kind of break through the treatment-resistant depression.
Interesting.
And then once you're at a higher, hopefully like a better mood level, you can just use the maintenance lozenges and every 6 weeks or so do another infusion to kind of keep you up. Some people don't ever need another ketamine intervention after the initial 6.
Oh, wow.
Some people do the initial 6 and don't feel any better at all. Some people would argue that a better regimen is actually 1 infusion to start every week for 4 or 5 weeks. And you don't need 6, you don't need them every other day for 2 weeks. So all of that is kind of still being figured out and still kind of being debated.
Yeah.
It's not, unfortunately, I'm pretty sure it's not actually, like there's not trials going on about what is ideal.
That's unfortunate.
Yeah, it's more like anecdotal. You hear different, especially the therapists who work in this area. To me, they have the best information about what infusion regimen is best for different situations. But it's pretty messed up, actually, the way they came up with the 6 infusion.
Why is
regimen.
that messed up?
It was like, I heard this story on a podcast from the person telling the story is Dr. Raquel Bennett, who's like the mother of ketamine for treatment-resistant depression. She's brilliant. And she said that the lab where they were going to do the study was busy twice a week for ECT treatments, which is another treatment for treatment-resistant depression, stands for electroconvulsive therapy. So it's electroshock therapy. And they did it, that regimen for that was twice a week. So they had the lab open 3 times a week. They're like, okay, we'll do the infusions then. Yeah. And that, unfortunately, like it worked and that's great, but they never tried any other regimen. Yeah. So there could be a different regimen that works way better.
Yeah. So it wasn't like any scientific method behind it. That is sad.
Exactly.
Oh, God. Yeah. It's ridiculous.
It's real dumb. Yeah.
Interesting. It's so strange. Like,
And you find that a lot, like the history of medicine, I feel like.
Yeah. It's just happenstance.
Like, well, I don't know. Yeah, try this. It's like, well, we thought it would be good for a diet pill, and it turns out it's good for solving cholera. And you're like, really? So anyway.
So yeah, I'm curious on the 6 times. So, okay. So what did you do and how did it work for you is what I wanted to ask.
Sure. Yeah. So back in 2018, I did, or no, I'm sorry. In 2019, I actually did a 4 infusion regimen once a week.
Okay.
So the reason some people opt for that more spread out regimen is to allow time for therapy in between. So every infusion, I had a session with my therapist to set an intention. Then I had the infusion, and then I had a session with my therapist to do the integration.
Nice.
And I did that every week for 4 weeks.
Cool. That seems like it makes a lot of sense.
Yeah, I find a lot of therapists prefer that
Okay.
more spread out.
Yeah.
Yeah. And we'll have an episode on the medical approach
Okay.
versus the kind of more therapeutic approach
Okay.
also.
Cool. And so how was that for you? Like, how has this gone?
Honestly, not great. It was a real disappointment, the first 4. I kind of was under the impression, I definitely was under the impression that if it worked, it would work after 4. And I might never have to see my psychedelic therapist ever again or do another infusion. This was early days in ketamine infusions. It still is early days, but it was even earlier. And I ended up doing, I think, 6 over 6 weeks. And ketamine has helped better than any other drug I've ever taken. And I've taken probably literally a dozen different types of antidepressants, different antidepressants. But, and ketamine is definitely the most effective.
Okay.
But honestly, it was a real disappointment because I thought it might cure me and it didn't.
Yeah.
And we have I think also we'll do an episode on, the idea of a cure for treatment-resistant depression is, for a lot of people, it's a chronic illness that needs to be managed over a lifetime once it develops. And there's no single intervention that'll solve it.
Yeah. And
so that was my experience with ketamine. It was really helpful, but it didn't solve it.
Okay. And it's good to just go into it with that mindset, knowing that it's not like this is necessarily the silver bullet. I mean, maybe it will be for some people, and that's great, but it wasn't for you, but it was the best thing you've tried, which is awesome.
Yeah, exactly.
Okay.
Yeah,
Cool.
For sure. Yeah, I wouldn't give up my ketamine.
Yeah. Would you say that you had a breakthrough? Or not necessarily?
I would say over the 3 years of using ketamine, yeah, for sure.
Yeah.
Like the one thing I can say for sure about ketamine that I can't say about any other drug at all is that it has made me psychologically more healthy.
Nice.
Which is different than lifting mood.
Yeah. Okay.
So it's helped me like forgive myself, for example.
Okay. Well, that's cool.
Things like that, as opposed to, like an SSRI is not going to help you forgive yourself.
It just makes you feel better, but it doesn't actually get at the root of how you're feeling. That's really interesting. That's a good insight into this. So it's actually making you psychologically more healthy. That would be a whole interesting subject for a podcast, maybe. Like, what's the sort of the difference, how ketamine maybe helps you, or how your experience with how it's helped you compared to typical antidepressant like an SSRI, like mood lifting versus psychological health, this forgiving yourself, maybe understanding yourself in a way. That's super interesting, giving you insights. And I think
the insights like are priceless. And the idea that you can just use ketamine as a chemical and not try to cultivate the opportunity to have those insights is a real, I think, opportunity lost for a lot of people who are doing ketamine and not doing the journaling, not doing the intention setting, the integration, all that other stuff.
Yeah.
They're missing that benefit, which is a huge benefit.
Yeah. Interesting.
Yeah.
Cool. Okay, so did we cover all the different ways you can take ketamine?
We did. We
did.
That's them. Just to review real quick, it's Spravato, the nasal spray, Infusions, Intramuscular Injections, oral lozenges, and everyone's favorite, the Rectal Suppositories.
Of course.
That's it. So I think that's all for today. We're going to make this podcast weekly if we can.
That's right.
And if you want to contact us with like recommendations, a story that you want to share, ideas for the show, a weird segment we can include, let us know. We are at ketamineinsights@gmail.com. Anything else, Miss Lynn?
I think that's it, but we definitely look forward to hearing from our podcast listeners. So please do reach out.
Thanks, everybody.
Thank you. Bye.
And that is our first episode of Ketamine Insights. Thank you so much for listening. I have one little correction. It turns out that what happens when you're tripping balls is not called disassociation. It's dissociation. My bad. Anyway, we have a YouTube channel with clips to share. We're on Instagram at Ketamine Insights. Our website is ketamineinsights.com, and you can email us at ketamineinsights@gmail.com. If you liked this show, please subscribe, rate it, and share Ketamine Insights with someone you love. See you next week. Ketamine Insights is hosted by Lynn Schneider and Molly Dunn. Editing and production by Molly Dunn. Our theme music is by Solid State Symphony. Thanks for your patience while I learn how to make a podcast.